Good morning, everyone. In this video, we'll show you how to achieve a deep latch and position your baby correctly on a nursing pillow with Dr. Silva. I'm Dr-Silva, a pediatric osteopath, and I'm Maria Chiara, a mother of 3 and a freelance midwife. Here with us is Laura and her little one Noah, who's just 2 weeks old. Before we start the practical part, remember that for a deep, pain-free and effective latch, 2 factors are crucial. A mother who knows how to position the baby well, and a baby without mouth or neck tension that could limit opening and cause non-nutritive or painful sucking. If the baby has a poor latch and the mother experiences breast pain, it's essential to see a pediatric osteopath who can check for and massage out any tension to fully resolve the issue. This way, you'll be able to latch the baby painlessly, ensuring effective nutrition. As we mentioned earlier with Laura, we like to think of breastfeeding as a dance. In this dance, there are 2 partners, a mother doing her part and the baby finding the same rhythm. So what should we focus on? As Matteo said, ensure a deep latch in any position you hold your baby. A deep latch is when, first, you're not in pain. This is crucial. And second, you don't feel the baby slipping off the nipple. To achieve this, there are some key points to remember, primarily how we bring the baby to the breast. The breast shouldn't be low, as this limits the baby and prevents them from opening their mouth fully. It's much easier for them when their head is tilted back slightly, with their chin up and nose away from the breast. To ensure this, we should consult a good osteopath to check for any muscle tension or stiffness that might limit the baby's crucial work at the breast. Today with Laura, we'll look at 2 popular breastfeeding positions: the cradle hold, as she's using now, and the rugby hold. The first position we'll examine is the most comfortable and well-known, the cradle hold. It's called cradle because, as Laura's doing, we hold the baby snugly wrapped. This position is usually the favorite for both moms and babies. But what should we be careful about? In this position, the baby shouldn't be too high relative to the breast. Noah shouldn't suckle like this, or worse, like this. He shouldn't curl up, but stay nicely extended. We really need to let them experience this because instinctively, a newborn, especially in the first weeks of life, tends to curl up in a fetal position, and this isn't the ideal position for a good latch on the breast. So always make sure there's no space between mom and baby. Keep them close, just like Laura is doing. With your free hand, gently press the baby's back against your belly at chest level to keep them as close to you as possible. Another important thing is the head position. They should never be sucking like this, okay? We'd be uncomfortable swallowing in this position too. Keep head, chin, and shoulders aligned so they're straight. See how Noah's tummy is facing his mom? He's not sucking with his belly towards the ceiling. Another crucial point, the chin touching the breast. If you look, Noah's chin is right against his mom's breast. We can't even see it anymore. This is another important sign we need to watch for and ensure the nose is free, not just for breathing, but to show they're looking up, so the nose is detached from the breast. Now let's move on to the practical part. With a hungry baby and available mom, we need to position our nursing pillow for essential support. So first thing, let's get Laura ready. The nursing pillow fastens behind, freeing your hands and letting you move without losing support. Now let's bring Noah over. Noah, come here, we need you. Here he is. First, how do we bring Noah to the breast? As you can see, Laura is quite experienced. Laura's the 2nd-time mom and it really shows. She turns Noah so his tummy faces hers. With one hand, she knows how to hold her breast. We aim it towards our baby's mouth. There we go. Noah is slightly behind the nipple because we aim the nipple towards his little nose. We wait for him to open his mouth wide, and we can guide the initial latch on. It's called guided latching teaching the baby proper technique for independent feeding. Once latched, we gently slide him back, clear his nose, and the more he looks up, the deeper the latch. A correct latch feels secure without pain. Trust your instincts and get comfortable. Laura supports Noah's head from ear to ear, not pressing down to avoid making him feel smothered. This gives support while allowing freedom of movement. Laura, you can pass your other hand under him. There, make sure his head is always looking up. The goal is for Laura's shoulders to be well supported. She should be in a position where neither arm nor shoulder is tense. Even a few pounds, held for many minutes daily, can strain our back, so ensure full support for your baby's weight. Now, as you see, we've turned the cushion slightly to show the rugby hold position. First, let's slide Noah back a bit. His tummy should face Mum, so make sure it's not pointing up. Laura, use one hand to guide your breast towards his mouth, which has now shifted position. Aim towards his nose. See how Noah's chin is always supported? I think, Laura, you can slide him a bit further back. See, we had a shallow latch. Look how he searches, aiming for the nose, okay? When he actively searches for the breast, that's the best moment to latch him on. Even in this position, we see Laura still supporting Noah's head between his ears, making him look up. You can always do this. This way, his nose is free, chin well tucked, and we can see he's latched on well, not just on the nipple tip, okay? This rugby hold could be especially useful if you need to drain one area of the breast more than another.